A typical vertebra, meaning any one of the vertebra, we have the body and the transverse process on the sides, the spinous process, and the vertebral foramen where the spinal cord goes. And then we have the superior articulating processes or facets and the inferior articulating processes or facets. And the vertebrae go together then, where the inferior and superior are going together, and they form this vertebral foramen, which is where the spinal nerves come out. Here we're looking at a group of cervical vertebra. The key feature of a cervical vertebra is holes in the transverse process called transverse foramina. And so if you see that, that's a landmark to identify a cervical vertebra. They're for blood vessels. And starting with the very top cervical vertebra, this is the atlas vertebra, or C1, or the atlas vertebra. And its characteristic is this huge vertebral foramen where the spinal cord hasn't quite tapered. Then we go to C2, or the axis vertebra. Its identifying feature is this odontoid process that sticks up kind of like a tooth. Once again, it has transverse foramina. And then additional cervical vertebra, again, that look more typical of a vertebra with the holes in the transverse process, again, denoting cervical vertebra. Now we're looking at a thoracic vertebra. Again, in your analogy book, it says it looks like a giraffe, which I believe it kind of does. It does not have holes in the transverse process, so it's not cervical, and it has kind of a long, pointed spinous process for muscle attachment. Next are the lumbar vertebra. They're bigger, bulkier vertebra. We have L1 through L5 vertebra. And again, the analogy book describes the spinous process looking like a moose. Now we have the sacrum, or the sacral vertebra, this structure where vertebrae have actually fused to form the sacrum. And we have what are called dorsal sacral foramina, holes in the sacrum. And also we have this median spine that also runs down the sacrum, called the median sacral crest. And then finally we have the coccygeal vertebra, the last four vertebrae of the vertebral column.
This is the pelvic girdle. We have a series of bones that make up a right side and a series of bones that make up the left side. They both articulate with the sacrum across the back. Each of these half units here is referred to as an os coxae. These are in turn made up of three different bones which fuse together as one moves through adolescence. The lower bone coming off of here is the ischium, with a large swelling that you're sitting on when you plop yourself down in a chair. The pubic bone comes across the front, and the ilium runs across the back. Some landmarks on the ilium, one of which is the iliac crest. Important, it's easy to palpate on your lower back. In turn, there are a series of spines on this. We're going to refer to this one only, which is the superior anterior iliac spine. Coming down, the pubis bone in turn articulates with the pubis on the other side. In the middle of these two is the symphysis pubis, made up of this fibrous connective tissue. And in turn, these three bones, ischium, pubis, ilium, fuse together in this region right here, which is referred to as the acetabulum. The acetabulum, in turn, if you look into that, has this, what appears to be a quarter moon in their lunate surface, extra bone that's added where it articulates with the head of the femur. Through the front, we see a distinct large opening. This is referred to as the obturator foramen, or foramen. And coming across the back, we have, I don't think you have to know that, so forget that. We have also, though, a final spine which comes off the ischium here, and this is referred to as the ischial spine.
Here we have the femur bone, and this is the head of the femur that goes into the acetabulum on the pelvic girdle, and then two distinct marks, the greater trochanter and lesser trochanter, big bony protrusions for muscle attachment. And then below the head is the neck of the femur. And then normally this is where the patella, the kneecap, would go. And this articulates then with the tibia below. So this is your knee joint. And so now we have the tibia, and then in this case the broken fibula. The tibia is always medial, and the fibula is lateral. Also back to the femur, we have two condyles, the medial condyle, which is always on the same side as the head, and the lateral condyle. Again, those articulate with the medial and lateral condyle of the tibia. Okay, and so now moving down below the tibia, of course, on the medial side we have the medial malleolus, which is your inside ankle bone, and the lateral malleolus, part of the fibula, that's your outside ankle bone. So medial and lateral malleolus are your two ankle bones. And of course that's what then articulates with the foot. And on the foot, the two major tarsal bones or ankle bones are the talus, which articulates with the tibia, and the calcaneus, which is really your heel bone. And then the rest of the bones collectively are tarsal bones, all have individual names, and the metatarsals and phalanges, comparable to the bones in the hand.
So here we have the articulation between the femur and an os coxae, the right os coxae and right femur here. And we're looking for the ligaments that hold these bones together. And if you can recall again what the three bones of the os coxae are, the ilium, the pubis, and the ischium coming over from down below. And knowing that this is running to the femur, it's easy to recall the names of these major ligaments that connect these two bony structures together. So what we have coming off of the ilium, and if you can look at the fibers, the direction the fibers run, you can see that this would then be an iliofemoral ligament. Coming off of the pubis here, watching again the way the fibers run, and if you get this model and look close at it, you can see the way those fibers run, connecting then the pubis to the femur, so this would be the pubofemoral ligament. And then coming off down below, a little bit more difficult to see in this particular case, and it's really much more complex than this, but coming off the ischium down below, we then have an ischiofemoral ligament. Three major ligaments then, going from bone to femur. If you know the three names of the bones, you know the name of this bone, you can get all three of those correct.
We're looking at the right knee. This is the femoral tibiofemoral joint, and the two bones, of course, again, are the femur articulating with the tibia. So we have condyles again, the lateral condyle of the femur and the lateral condyle of the tibia, and on this side then the medial condyle of the femur and the medial condyle of the tibia. So those are the two condyles that meet together, and of course this is the fibula, again on the lateral side of the knee. The ligaments, the big ligament then coming down, connecting the femur to the tibia, is the patellar ligament. And then again on the lateral side we have the lateral collateral ligament and the medial collateral ligament. And then we have two cruciate ligaments, the posterior cruciate ligament in the back. It's hard to see in this, but the anterior cruciate in the front, again those crisscross. And then we also have meniscus cartilage, the medial meniscus and lateral meniscus cartilage that help pad that knee joint. The abdominal muscles, there are four abdominal muscles, starting with the external oblique, fibers running like your hands are in your pocket, and then perpendicular to those are the internal obliques, which stop about right there. And then we have the transverse abdominis that run underneath the rectus abdominis or the rectus sheath. They're running anterior and posterior in the cat. The shoulder then, under the acromia trapezius, here we have the spine of the scapula, which is a nice landmark because above that is the supraspinatus, below it is the infraspinatus, and then at the very bottom is the teres major. And then under the scapula is the subscapularis, again under the scapula, and then now we see nicely the rhomboideus group, and the one going off to the head is the rhomboideus capitis, and then we have the rhomboideus minor or rhomboideus cervicus, and then finally the rhomboideus major or the rhomboideus thoracis are the ones that wrap around the back edge of the scapula.
Looking at the hind leg of the animal and looking at the muscles that come off the butt region, we have a very large muscle that runs down off the back, down to the tibia here. Large muscle, the biceps femoris, two bellies. Directly anterior to that, or more cranial to that, toward the head, is the caudofemoralis, running from tail to femur. The glutes are here, gluteus maximus, gluteus medius, gluteus minimus underneath, but you don't have to know that. And then this muscle here, lying much like a triangle or a pyramid, which most of its facial sheath gone, but you can still see a fair amount of it here, is the tensor fasciae latae. Peeking out from here is going to be the sartorius, and we'll come back and talk about that on the other side. As we come down into the calf, if we pull back the biceps femoris, what we do see at this point is the lateral head of the gastrocnemius muscle showing here.
So again, we saw the lateral head of the gastrocnemius, and the inside is the medial head of the gastrocnemius. But then running right down the middle, you see, is the plantaris and then the soleus. So the three parts of the calf here are the gastrocnemius, the plantaris, and the soleus, and all those make up your calf, and they all help to extend the foot. And then finishing the lower leg, we have the tibialis anterior that again runs just lateral to the tibial bone.
So as we look at the medial side of the leg, there's a large muscle here. This is the gracilis, and a large muscle here, a flat sheet of muscle. This is the sartorius. On this side, what we've done is cut those. So I'm going to pull the gracilis down. I'm going to pull the sartorius up just a touch. But let's take a look at this set of muscles that we find underneath the gracilis. Running up the back of the leg, a long muscle running up the back, is the semitendinosus. The muscle running next as we go toward the midline of the body is the semimembranosus. Here we have the adductor femoris, the adductor longus, which is a thinner muscle right here, and the pectineus. Semitendinosus, semimembranosus, adductor femoris, adductor longus, pectineus.
The final group, again, this is the sartorius. We've bisected it because we want to see the muscles deep to that. And we have the quadriceps femoris group. So here you can clearly see 1, 2, 3, three parts of the quad. The fourth part is under this. And on the medial side, the vastus medialis, the rectus femoris, and then vastus lateralis. And then deep to the rectus femoris is the vastus intermedius. So the whole group is the quadriceps femoris group, again meaning 4, vastus medialis, vastus lateralis, vastus intermedius, and on top rectus femoris. Again, all of those underneath is sartorius.